guys, I just got back from Run Club, and one of the girls at Run Club has been having lower back pain since July 1st. I just wanted to go over the case with you because I did do a little assessment after I run. I'll give you a little bit of a history. She's a marathon runner, currently training for the Chicago Marathon on October 12th. The pain began on July 1st. It was an insidious onset, no incident, just came on. The pain began on the right side, lower back, outer hip. That did begin to improve with a bit of rest and some chiropractic and acupuncture. I think she also did some rehab exercises. And then it did improve, so she started upping her distance. And then she's recently, over the last week and a half, developed left side low back outer hip pain. So it's kind of switched sides. So I'll kind of give you a breakdown now of what I did for the assessment. I did some palpation, and there's definitely some very tight outer hip muscles, glute med, glute min, piriformis on the left side. Right side was tight, but not as much. Low back seemed pretty good, and the left SI joint was a little bit locked up. I then did some muscle testing. So I wanted to do this because it sounds like there's a muscle imbalance issue. I think that the left side lower back is now compensating for the initial injury that occurred on the right. Upon the exam, which I'll put after this video, I found that she had right hamstring weakness, which she later disclosed that she had torn her right ACL a while back. So that makes complete sense. So we're gonna have to do some strengthening there. And then I found pain in the left outer hip on resisted muscle activation. The erector spinae seemed pretty good, and then some weakness in the right glute max. So there's definitely some muscle imbalance in between each side, which is common for runners. When you're running, you're always on one leg, so it's really important to strengthen the outer hips. So I'll put the assessment in a little fast forward video, and then I'll fill you in on what we're doing for her treatment plan. So I'm going to bring this leg up and just hold it there, and just resist me pushing down. Any pain or anything? No. Now I'll be laying on your side away from me first. I'll just lifting this leg up and just resist here. Bit of pain. And then we'll do the other side too. Was it in that spot on the back? Yeah, you can like just lay down here like this. And then just right on your side. Did that one hurt? That one nice. And then here, and then the thing is like up a little, and just hold the leg there. And I'm gonna push down and just resist. Yeah, so and that hurts, or just with no strength, like it's like right on the spot. That one's stronger. And then for this one, I'm just gonna bend here and just resist me. And then resist here. That's stronger. I also tore my ACL in that leg. On the right. And then we're gonna keep the leg straight, and then I'm just gonna push it down. So now that we've seen the assessment and we've gone over the history, let's talk about next steps. So I recommended that she first get an x-ray. It's been 2 months with treatment and she hasn't gotten better. To me, that's a red flag. She's a distance runner. She does a lot of kilometers in a week, and we just want to rule out a stress fracture because it is more common in female runners as well. So depending on what that comes back, if it's positive, we're going to go to low impact exercise. That means biking, that means elliptical, and swimming. Even while we wait, I did recommend doing at least half of her runs transferred to a low impact exercise. I know it sucks and it's not what any runner wants to hear, but we got to be a bit conservative right now. And then secondly, I did provide her with a Pilates video and some Pilates rehab exercises. I'll link that into my bio. It's a bit more catered to running warm-ups, running stabilizing muscles, but it's something that everyone can do and it's beneficial to try. So I'll link that in my bio. And then lastly, in terms of treatment, no adjustments until we know what the x-ray says, and continue with the acupuncture and muscle work. That way we're still loosening the muscles and taking away the hypertonicity, but then we're going to start building up that strength. All right, that's our first case on here, so super excited to go through my thought process with you. If you have any questions, please feel free to comment below.